Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing a very short note and a very important Viva question, and that is what is the blood supply of tonsil? Now, we find it very difficult to remember because there are so many arteries supplying the tonsil over here, but I'll talk about a very easy mnemonic with the help of which you can remember all of these arteries. You can also now purchase my notes. I have added links in the description. Okay, so let's look at the image over here. So all the branches of the tonsil comes from the external carotid artery. Now let's look at the image here. This here is the external carotid artery, and as it goes upwards, it divides into its two terminal branches, which is the superficial temporal artery and the maxillary artery. Now this external carotid artery will give multiple branches which will eventually go and supply the tonsil. So first one is the ascending pharyngeal artery. You can see this artery over here which is going up like this. This is the ascending pharyngeal artery, and this ascending pharyngeal artery gives off some tonsillar branches to supply the tonsil. So that is our first supply. Second, we have the lingual branch coming from the external carotid artery. This is a lingual branch, and the lingual artery itself gives dorsal linguae branches to supply the tonsil. So this is our second one over here. Next, the third artery that the external carotid artery gives rise to is the facial artery. So this is our third one. Now facial artery has two different branches which goes and supplies the tonsil. The first one is the tonsillar artery, which is the main supply of the tonsil. And the second one is the ascending palatine artery, which is over here. So facial artery is giving off two branches, the tonsillar artery being the main branch, and the second one is the ascending palatine artery. Lastly, the maxillary artery, if you see here, it gives off a branch which is known as the descending palatine artery, and this also goes and supplies the tonsil. So we have total 5 branches coming over here. The main one is the tonsillar artery, which is a branch of the facial artery. Second is the ascending palatine artery, which is also a branch of the facial artery. Third is the dorsal linguae branches of the lingual artery. The lingual artery itself is a branch of the external carotid artery. Fourth is the ascending pharyngeal artery, which is a branch of the external carotid artery. And lastly is the maxillary artery, which gives off the descending palatine branch. So these are our 5 branches which are giving the arterial supply to the tonsil, and out of this, the tonsillar artery is the main supply over here. Now, how do we remember this easily? So we remember the mnemonic MALT. With M is the maxillary artery. As I said, maxillary artery gives off the descending palatine branch. There are two A's over here. One A is for the ascending pharyngeal artery, which is a branch of external carotid artery. The second A is for ascending palatine artery, which is a branch of the facial artery. L is for lingual artery, which gives off the dorsal linguae branches. And lastly, T is for tonsillar artery, which is a branch of the facial artery. So we have our 5 arteries over here, which we can remember with this mnemonic MALT. I hope you have understood this. I'll see you in my next class. Thank you.